Imagine a medication capable of making you lose up to 20% of your body weight in just a few months. Sounds like a miracle product promise, doesn't it? But we're talking about something real, science-approved, and causing a genuine revolution in obesity and diabetes treatment. The name? Mounjaro. But hold on. Before you rush out to get this medication, you need to know the whole truth. Because along with the impressive results come controversies, serious side effects, and even ethical problems that are making the medical community's hair stand on end. Today, here on Everything Uncovered, we're going to break down everything about Mounjaro. What it really is, how it works, why it became a social media sensation, what risks nobody tells you about, and most importantly, whether it's actually worth it. Stay until the end because we'll reveal information that could completely change your view of this medication. To understand the Mounjaro phenomenon, we first need to look at the bigger picture. Obesity has become one of the greatest epidemics of the 21st century. According to the World Health Organization, more than 1 billion people worldwide are above what's considered a healthy weight. In the United States, the numbers are equally alarming. About 70% of adults are overweight or obese. For decades, medicine tried to combat this problem with restrictive diets, physical exercise, and medications that, at best, offered modest results. Many had terrible side effects or simply didn't work long-term. Bariatric surgery was always an option, but it's invasive, expensive, and brings its own risks. Then, in recent years, a new class of medications began to completely change the game. First came Ozempic, which you've probably heard of. It became a global sensation, with celebrities admitting to using it and millions of people seeking prescriptions. But now there's something potentially even more powerful, Mounjaro. Initially approved by the FDA in May 2022, Mounjaro was developed by pharmaceutical company Eli Lilly specifically to treat type 2 diabetes. But doctors soon noticed something extraordinary. Patients were losing weight dramatically. Not just a few pounds, but massive losses comparable to those achieved with bariatric surgery. What started as a medication for diabetics quickly transformed into an object of desire for people who simply wanted to lose weight. And that's where the story gets complicated. Let's get to the basics. Mounjaro is the brand name for tirzepatide, an injectable medication applied once a week, usually in the belly, thigh, or arm. But what makes this medication so special? Tirzepatide belongs to a revolutionary class of medications that mimic natural hormones in our body. Specifically, it acts like two hormones simultaneously, GP, which stands for glucose-dependent insulinotropic polypeptide, and GLP-1, or glucagon-like peptide 1. I know, the names are complicated, but I'll simplify it for you. These hormones are naturally produced by our intestines when we eat. They have several crucial functions. They stimulate insulin production by the pancreas, reduce sugar production by the liver, decrease appetite, and slow gastric emptying. In summary, they help control blood sugar levels and make you feel satisfied longer. Here's what makes Mounjaro different. While medications like Ozempic mimic only GLP-1, Mounjaro mimics both GLP-1 and GIP. This dual action seems to create a synergistic effect, meaning an even more potent result than each hormone would have individually. When you inject Mounjaro, it binds to these hormone receptors in your body's cells. The result? Your pancreas produces more insulin when needed. Your liver stops dumping sugar into the bloodstream. Your brain receives stronger satiety signals, and your stomach empties more slowly, making you feel full for hours. For type 2 diabetics, this means better glycemic control. For people with excess weight, it means drastically reduced appetite. Many patients report that they simply don't feel hungry. Foods that were once irresistible lose their appeal. Portions naturally decrease because the body signals fullness much faster. Clinical studies showed impressive results. In the SURMOUNT research program, which included thousands of participants, people using the highest doses of Mounjaro lost an average of 21% of their body weight in 72 weeks. To put this in perspective, a person weighing 220 pounds would lose about 46 pounds. That's more than most diets achieve and approaches the results of bariatric surgeries, but without a scalpel. Beyond weight loss, studies showed improvements in important health markers, blood pressure reduction, decreased bad cholesterol, improved liver function in people with fatty liver disease, and of course, exceptional glycemic control in diabetics. So how did a diabetes medication become the holy grail of weight loss? The answer lies in the combination of real results, social media, and the eternal human desire for quick solutions. It all started when the first users of Mounjaro and similar medications began sharing their dramatic transformations online. Before and after photos flooded Instagram, TikTok, and Facebook. People who struggled with weight their entire lives were finally seeing the numbers on the scale go down consistently. Celebrities also jumped on the bandwagon, some admitting publicly, others denying despite obvious evidence. The Hollywood whisper was clear. This was the secret behind sudden body transformations of movie and television stars. The media caught the story and ran with it. Articles about the new miracle weight loss drug multiplied. Fitness and wellness influencers began discussing the topic, some with accurate information, others not so much. Doctors who prescribed the medication became minor celebrities in their own circles. Specialized weight loss clinics quickly added Mounjaro to their service menus. Telemedicine consultations made access easier, allowing people to get prescriptions without even leaving home, sometimes with questionably superficial medical evaluations. The market reacted, demand exploded. Pharmacies began facing shortages. And here we arrive at one of the most controversial aspects of this story. People who really needed the medication to control type 2 diabetes began having difficulty finding it, because much of the stock was being consumed by those seeking only to lose weight. Diabetic patient organizations raised their voices, pointing out the ethical problem of essential medications being diverted for cosmetic use. The situation became so critical that Eli Lilly itself had to drastically increase production and implement distribution control systems. But the hype didn't stop. If anything, it got stronger. Because unlike so many empty promises of the past, this medication really works for most people. And in a world obsessed with appearance and where obesity stigma is still huge, the promise of a relatively easy solution is simply irresistible. Now let's talk about what many influencers and weight loss clinics don't emphasize enough. Side effects. Because yes, they exist, and some are quite unpleasant. The most common side effect of Mounjaro is gastrointestinal. We're talking about nausea, vomiting, diarrhea, constipation, and abdominal pain. In clinical studies, more than 1/3 of participants reported nausea, especially in the first weeks of treatment or when the dose is increased. For some people, this is mild and passes. For others, it's so intense they need to discontinue the medication. Imagine feeling constant nausea like you have a permanent hangover, or going days without having a normal bowel movement. Or the opposite, running to the bathroom several times a day. Not exactly glamorous, right? But this rarely appears in transformation posts on Instagram. Another problem is what's being called Ozempic face, or Mounjaro face. When you lose a lot of weight quickly, especially if you're older, the skin may not keep up. The result? Hollow face, sagging skin, aged appearance. Ironically, people seeking to improve their appearance may end up with a face that looks 10 years older. Some resort to cosmetic procedures to compensate, adding costs and risks to the process. There are also more serious concerns. Animal studies showed an increased risk of thyroid tumors. That's why Mounjaro comes with a black box warning, the FDA's most serious type of alert, contraindicating its use in people with personal or family history of certain types of thyroid cancer. We still don't know for sure if this risk translates to humans, but it's a legitimate concern. Pancreatitis, a severe inflammation of the pancreas, is another potential risk. Although rare, cases have been reported. Symptoms include severe abdominal pain, nausea, and vomiting. In severe cases, it may require hospitalization. Gallbladder problems, including gallstones, have also been observed. Rapid weight loss can increase the risk of stone formation in the gallbladder, which can cause intense pain and sometimes require surgery. For diabetics using insulin or other blood sugar-lowering medications, there's a risk of hypoglycemia, meaning dangerously low blood sugar. This can cause dizziness, confusion, cold sweats, and in extreme cases, loss of consciousness. There are also psychological aspects. Rapid changes in weight can affect mental health. Some people develop a problematic relationship with the medication, fearing weight gain if they stop. Others experience mood changes, anxiety, or even depression. And perhaps the most frustrating side effect of all, the rebound effect. Studies show that when people stop using Mounjaro, many regain much, if not all, of the lost weight. This raises a crucial question. Is this a medication you'll have to use for the rest of your life? And what are the implications of that, both financially and for long-term health? Let's talk about something that hurts almost as much as the side effects: the price. Mounjaro is not cheap. Far from it. In the United States, without insurance or coverage, the cost can easily exceed $1,000 per month. That's right, $1,000 per month. For a medication you'll probably need to use indefinitely if you want to maintain results. Do the math for a year and you're looking at $12,000 or more. In other countries, although prices vary, we're talking about amounts that can exceed several $100s monthly. For the vast majority of the population, this is completely out of reach. Mounjaro has essentially become a medication for those with financial privilege. Some insurance plans cover Mounjaro, but generally only when prescribed for type 2 diabetes, not for weight loss itself. Getting approval for off-label use, meaning outside the official indication, can be a frustrating bureaucratic battle. Many people end up paying out of pocket. This creates a glaring inequality. The wealthy have access to a powerful tool to lose weight and improve health markers, while lower-income people are limited to traditional methods that, let's be honest, have much lower success rates. Eli Lilly offers discount programs and coupons for some patients, but with strict eligibility criteria. Generic versions don't yet exist because the patent is far from expiring. There's a growing market for alternatives and compounds of tirzepatide from compounding pharmacies, usually cheaper, but with questions about quality control and efficacy. And there's another cost that doesn't appear on the price tag: proper medical follow-up. To use Mounjaro safely, you should have regular consultations, periodic blood tests, side effect monitoring. This adds more expenses and time. For many, the cost ends up determining how long they can maintain treatment. And there we return to the rebound effect problem. If you can't afford to use it indefinitely and the weight comes back when you stop, what's the point? You'll have spent a fortune to eventually be back where you started. It's a situation that exposes broader failures of our healthcare system. We have the technology to effectively treat obesity, a condition that increases risks of diabetes, heart disease, cancer, and so many others. But this technology is accessible only to a privileged slice of society. The Mounjaro phenomenon has raised complex ethical questions that the medical community is still trying to resolve. First, there's the question of prioritization. When a medication developed for a serious disease is massively used for a different purpose, even if related, who should have priority? Diabetics who can suffer serious complications without adequate glycemic control? Or people with obesity who also face real health risks? Obesity, it's worth saying, is recognized as a chronic disease by most medical organizations. It's not simply lack of willpower or laziness, as social stigmas suggest. It's a complex condition influenced by genetics, hormones, environment, psychological aspects, and much more. Treating it is legitimate and important, but what about when the use is purely cosmetic? When someone with a normal BMI seeks Mounjaro just to be thinner, perhaps to meet unrealistic beauty standards perpetuated by social media. Should doctors prescribe in these situations? Where do we draw the line? Some critics argue we're treating symptoms while ignoring root causes. Toxic food environments dominated by ultra-processed foods, sedentary lifestyles, chronic stress, social inequality that limits access to healthy foods and exercise spaces. Should we be investing more in prevention and structural changes instead of relying on expensive medications? On the other hand, defenders point out that moral judgment about obesity has done little beyond causing suffering. If we have a tool that works and can save lives by reducing obesity complications, why not use it? Nobody criticizes diabetics for using insulin instead of just trying harder. Why should obesity treatment be different? Long-term dependence is another concern. If people need to use Mounjaro indefinitely, what are the implications? Do we know the effects of 10, 20, 30 years of use? Not really, because the medication is very new. Are we potentially creating a generation dependent on perpetual weekly injections? And there's the question of weight loss clinics that prescribe Mounjaro with minimal evaluations, prioritizing profit over proper care. 15-minute online consultations resulting in prescriptions without complete exams or appropriate follow-up represent a real risk. So after all this, what's the verdict on Mounjaro? The honest answer is, it's complicated. There's no doubt that Mounjaro represents a significant scientific advance. For people with type 2 diabetes, it can be transformative, offering superior glycemic control with the additional benefit of weight loss. For people with obesity or significant excess weight, especially those who've already tried multiple approaches without success and face health risks, it can be a valuable tool. The results are real. It's not placebo, it's not misleading marketing. The medication works through well-understood biological mechanisms and has demonstrated efficacy in rigorous studies. But it's not a magic solution. It comes with side effects that can be significant. It requires substantial financial commitment. It works best, or perhaps only truly works, when combined with lifestyle changes. And when you stop, the weight tends to return, suggesting it may be a lifelong commitment. There's also the broader context to consider. We live in societies that actively promote weight gain through obesogenic environments, cheap and ubiquitous hypercaloric food, sedentary lifestyles, aggressive junk food marketing, and then sell expensive medications to treat the resulting problem. There's something fundamentally wrong with this cycle. If you're considering Mounjaro, some reflections are essential. First, why? Is it for genuine health or aesthetic pressure? Have you already tried lifestyle-based approaches with adequate support? Do you understand the risks, and are you prepared for possible side effects? Can you afford long-term treatment? Do you have access to quality medical follow-up? Most important, are you prepared for the lifestyle changes that will make treatment sustainable? Because taking Mounjaro while continuing to eat fast food daily and living a sedentary life may bring some results. But you're missing the bigger point. The uncomfortable truth is there's no easy shortcut. Mounjaro can be a powerful tool, but it's just that, a tool. It's not the complete answer. The complete answer involves understanding your relationship with food, moving your body regularly, managing stress, sleeping adequately, building sustainable habits. For some people, Mounjaro may be exactly what they need to break a vicious cycle and start a healthier journey. For others, it may be an expensive distraction from deeper work that needs to be done. And there you have it. Everything you need to know about Mounjaro, the medication that's revolutionizing and polarizing the weight loss world. Remember, this video is informational and doesn't replace professional medical advice. If you're considering Mounjaro or any medication, talk to a doctor who knows your complete history and can properly evaluate whether it's appropriate for you. What do you think? Is Mounjaro a legitimate medical innovation or another example of excessive medicalization? Would you use it, or do you know someone who has? Share your experiences and opinions in the comments. If this video was helpful, leave your like, subscribe to Everything Uncovered for more evidence-based health content, and hit the bell to not miss upcoming videos. Until next time, and remember, your health is your greatest wealth. Take good care of it.